Dr. Martorell. I am going to be discussing the topic of marijuana or cannabis. Marijuana, which is also cannabis, weed, pot, dope, right? Depending on how the person knows the term, is the dried flowers, leaves, stems, or seeds of the cannabis plant. There are more than 100 compounds or cannabinoids. These compounds include THC or tetrahydrocannabinol, which is the one that has an impact of impairing or mind-altering attributes. There is another compound, CBD or cannabidiol. CBD is not impairing and it does not cause that high effect. So marijuana is different from CBD or cannabidiol. So the CBD can be derived from hemp, which is defined as any part of the cannabis plant with no more than 0.3% of THC. So marijuana can be used in different modes. It can be used or smoked as joints, as cigarette, in blunts like cigars or cigar wrappers, or in bongs like pipes or water pipes. It can also be mixed or infused in foods like cookies, cakes, brownies. These are the edibles. And it can also be infused in drinks. It can be vaped using electronic vaporizing devices like the e-cigarette or the vape pens or other vaporizers. You know, the cannabinoids in marijuana can also be extracted to make oils and concentrates that can be vaped or inhaled. So marijuana, it can contain THC or the tetrahydrocannabinol that may have health risks regardless of how it's being used. It can affect THC. It can affect the memory, attention, decision making, and risk taking. And just keep in mind that marijuana and the e-cigarette or vaping has been associated with lung disease or EVALI. So what determines how marijuana may affect a person? It depends on multiple factors. It depends on the previous experience that the person has had with marijuana and how long the person has used it and how much. You know, also biology or the genetics may have an impact. Sex, you know, for example, women may experience more dizziness after the use of marijuana compared to men. How the drug is taken, for example, if it's edibles or products that have high THC concentration, how much of it is used, how often is used, and of course, if it is used with other substances like alcohol or other drugs, it may increase the chances of harm or drug interactions. You know, the marijuana plant has compounds that may help symptoms for some health problems. Cannabinoid product can be inhaled, can be ingested in edibles, also sublingual or oral mucosa, suppository, topical, and even waxes. There may be some clinical applications or some reasons why some providers may indicate or recommend medical marijuana. Always talk to your provider before using this for medical reasons. One of the indications is chronic pain, for example, severe or persistent muscle spasms. In the use of post-traumatic stress disorder, can be used in chemotherapy-induced nausea. And for example, the FDA has approved dronabinol and nabilone for that use. It has an FDA indication for some seizure disorders. It may be used for palliative care or end-of-life care in the setting of cachexia and wasting, in particular patients with cancer or HIV/AIDS. It may help with nausea and increased appetite in that setting. Some people ask if people can become addicted to marijuana, and the answer is yes. About 3 out of 10 people who use marijuana may have some form of marijuana use disorder, and that really means that they are not able to stop the use use, even though it may be causing them some social and medical harm. Some people ask, how do they know if they are addicted or how to recognize it when they are trying to use more marijuana than what it was intended, trying but failing to quit using marijuana, spending a lot of time using and thinking about marijuana, craving, using it even when they are at home or school or at work or doing other activities. They feel like they have to continue even though it is causing them problems at their jobs or school or, in social circumstances or relationships. When the person has to give up important, activities because they need to consume more marijuana. When someone is driving and they are using marijuana, they keep using even though it is causing them psychological problems and also physical problems. They need to use more marijuana to get the same high effect that they were having with less amounts in the past, and also experiencing like withdrawal effects when they stop marijuana use. Fatal overdoses are unlikely, but marijuana can cause some significant harm in some people. Some of the symptoms that may be suggestive of an overdose include extreme confusion, anxiety, paranoia, panic, the fast heart rate, high blood pressure, hallucinations and delusions, and severe nausea and vomiting. Sometimes people can have accidents as a result of those effects, or poisoning or overconsumption. Marijuana should not be mixed with other substances such as alcohol or other drugs or prescription drugs. Always discuss the use with the provider. The synthetic cannabinoids are man-made chemicals. They are not really marijuana or cannabinoid medications. These products are unregulated, and they can also affect the brain in much powerful ways than marijuana, and it can create also side effects and toxicity. There has been cases of severe significant injury and death from the use of cannabinoids or synthetic cannabinoids. For pregnant people and people who are breastfeeding, it is not recommended the use of marijuana. There can be effects of secondhand marijuana smoking in non-smokers, especially in babies, young children, and even adults. THC, secondhand smoking, they could develop the high and other symptoms. I hope this information was helpful. Always remember to review your needs with your medical provider. Join my social media. Take care.